Hi, if you're a climber or if you train for climbing, chances are that you've either had a finger injury, you have a finger injury, or you know someone who's had a finger injury. I'm Dr. Lexi at Summit Sport Chiropractic, and today I'm going to talk about what I do to prevent finger injuries for myself and treat them for myself, and how a lot of those same principles apply for my patients. So the first thing we're going to talk about are the Advantage collagen peptides. I take these every day in the morning with a cup of coffee and before my workout about half an hour to an hour before. Sometimes that's the same thing. Sometimes it's just the cup of coffee in the morning. And this is something that applies for prevention and also as treatment. And the reason that this is important is that tendons and ligaments and muscle, bone, skin, most of the structures in our body are made up of mostly different types of collagen. And in a sport like climbing, when we're applying so much pressure to such small structures, especially for adults, we're breaking down collagen at a faster rate than we can lay it down, especially that we can lay it down in the orientation that we ideally want it there. And part of the risk for injuries is that degradation of collagen. So being proactive about it and allowing for there to be more bioavailable collagen is working in our favor. Another thing that I keep in my system or keep on my regimen year round is an adaptogenic or adrenal supplement. This just happens to be the one that I'm taking right now. It is a great blend. It's tested and free of heavy metals, but I do tend to rotate between different ones because as adaptable as the human body is, we do become reticent and learn what is being put into our systems. Just like you don't eat the same food every day, you do want to change some things up. Adaptogenic herbs are great because they do just that. They help the body adapt to what's going on around it. External stress can have an effect on what's going on internally with structures in our body. And adaptogenic herbs can help with that stress. No, they're not going to eliminate it. They're not going to change how we mentally deal with it, but they can help with things like sleep cycle and hormone levels. So the next few things are more acute for dealing with when a finger injury happens. And that would be dry needling. Dry needling is something that's harder to do on myself, but when you got to do it, you got to do it. And it's definitely something that I recommend for patients. Dry needling really helps to bring attention to the area and get in, specifically cause micro trauma to tendons and help with that initial healing process. The next would be blood flow restriction. So this is a BFR band. And what it does is really a few different things, but in the case of a tendon or ligament injury, you can change the neural afferent pathway not the pathway, but how that response is affecting that area. And you can have more hydration to these largely avascular structures with less external load. So what that means for maintaining density or recruiting that amount of muscle to get that response, you don't need to put as much weight on your harness or lift as heavy to get the desired results for the rehab. The last thing for an acute training situation would be taping. There's a lot of mixed feelings on taping for an injury, but mine sit in the area of the day-to-day task. So we don't want to be in a situation with a finger injury where the individual becomes afraid to use their finger or stays away from using it, because the way that that finger is going to heal and that we're going to get back into a normal movement pattern is to not be afraid to use it. So I like a kinesiology or a dynamic tape type of situation to use for like during work, to do a 2H, so not just like a usual 1H, but we can go over that taping pattern in another video because it's a little bit awkward to go from one screen to the next. But either way, sometimes when you have a finger injury, it just hurts to touch things, to grab stuff. So having a little bit of soft support that still allows for full range of motion gives the ability to go through every day-to-day task while still giving that minor strength building situation and doesn't allow for any fear building to happen in that neurology. And then the last thing would be to train consistently, train often, and load the tendons. Even after the injury, as it starts to begin to heal, the only way for it to really fully heal is to be under load. So start to ease back into training and don't waste time. There's no reason to take a large amount of time off unless that injury is substantial. And the way that you'll know the difference between a minor and a more substantial injury is to really get it taken care of. So if you have any questions about how severe an injury is, if you're not sure, if you have questions about what's going on with your body, I really advise you to seek qualified care.